Ketorolac or Toradol is also known is another NSAID. It's a powerful analgesic with minimal anti-inflammatory actions. The common use for it is pain relief. You don't use it more than 5 days, and it's for moderate to severe intensive pain. It's usually used post-op. Some of the side effects, just like other NSAIDs, are peptic ulcers, GI bleeding, prolonged bleeding, renal impairment, allergic reactions, suppression of uterine contractions, and premature closure of the ductus auratus. So that you don't want to give it if you are not ready for that vein to close, because NSAIDs promote that to happen. You can take it IV or IM. It's a parenteral administration. If IV, it begins in 30 minutes and peaks in an hour to 2 hours and persists for 4 to 6 hours. It's prolonged effects in renal impairments because it's harder for them to get it out. According to Davis, Ketorolac is for short-term management of pain, not to exceed 5 days for all routes combined. It inhibits the prostaglandin synthesis, producing peripheral immediate analgesia. It also has an antipyretic and anti-inflammatory properties, but remember those are both smaller than other NSAIDs. It does enter the breast milk in low concentrations. It's metabolized by the liver and excreted primarily by the kidneys. It can also be taken intranasally. It's just like an NSAID, so you are still watching in your cardiac patients. If they have cross-sensitivity to other NSAIDs, they're probably going to have this. You don't want to use it after a CABG surgery because of the risk of cerebral or any kind of bleeding. You also don't want to use it with your cerebral vascular bleeding patients. Advanced renal impairment is at risk for renal failure due to volume depletion. And the chronic use in the third trimester can cause constriction of that ductus arteriosus, that vessel between the pulmonary and the aorta vein in babies. It also may inhibit labor and increase maternal bleeding at the time of delivery, because remember, it works on those smooth muscles of the uterine. That's why NSAIDs, especially ibuprofen, are so good for when you're on your period. So some of the adverse reactions: stroke, drowsiness, myocardial infarction, edema, vasodilation, GI bleeding, abnormal taste, diarrhea, increased liver enzymes. It promotes bleeding. It prolongs your bleeding time. Remember, you don't want to ever use this for more than 5 days. So once again, it's an NSAID. So if they have asthma, aspirin-induced allergy, or nasal polyps, they're more at risk for developing a hypersensitivity to this. Watch for those rashes because of Stevens-Johnson's. You're assessing pain 1 to 2 hours after administration. On labs, you're watching liver functions, especially their AST and ALTs, because it may increase the levels. It also may cause their bone and creatinine and potassium to increase. For patient teaching, make sure they're taking it as directed. It can cause drowsiness or dizziness, so watch when they're driving. You want to avoid the concurrent use of alcohol, aspirin, NSAIDs, acetaminophen. If they're taking it intranasally, make sure that you've shown them the proper technique, and they need to open a new bottle every 24 hours, and they can only use it for 5 days. According to Lenny, Ketorolac is a powerful anesthesia with minimum anti-inflammatory action. Pain relief is equivalent to that of morphine. It is for use for managing acute pain of moderate to severe intensity. It is usually a medication for post-op pain. So with parental, which is IM or IV, the effect will begin in 30 minutes. It peaks in 1 to 2 hours and persists for 4 to 6. The drug is eliminated by your liver and through the urine. So some of the side effects includes peptic ulcers, GI bleedings or perforation, prolonged bleeding time, renal impairment, hypersensitivity reactions, suppression of uterine contractions, and premature closes of the ductus arteriosus. Okay, and that concludes this one.